graduate or bedpan, and then you remove it. And then you give the patient pericare. That's what you call a straight cath.
So
or
would
in
that be
and out.
for like a clean couch?
A clean cath.
Okay.
If you had to have a clean cath, they couldn't do that. Yes, we do that. And sometimes they used to say, you see the commercials where the guy catheterized themselves. Some people have neurogenic bladders. They catheterize themselves because they can't urinate. That's an in and out cath. Straight cath, clean cath. Yes, all those. We have leg straps here. We have another two different type of leg straps. When you put your Foley catheter in, how we say to secure it to their leg. Here's a leg strap. You're going to secure it to their legs. I'll let you play with it. We want to get going so you can practice your Foleys. And then they have, if you have to get I think the other day someone asked me about irrigating a Foley catheter. I told you either male, female tip. This is what I'm talking about. If you have to irrigate a Foley catheter. So this is a sterile procedure. I don't see them irrigating catheters anymore, but I'll show you a video of it when it comes up to it. This is a leg bag. If a person has to have a Foley catheter at home, this is a leg bag. Catheter is connected here. This is closed up here. The urine is collected into the catheter in the bag. People use this a lot when they don't want to, doctor don't want to release Foley catheter. Here is a condom cath, which we talked about yesterday or something. And this is the thing you put on just like you put on a condom. And this hooks to the bag. And this is supposed to wrap around the penis. And this is double-sided tape that wraps around the penis. And then the bag goes over it, the condom goes over it. It's never worked for me. It doesn't, it doesn't work. The client gets sweaty and it comes off all the time. Here's another straight cath. Benjamin was telling me that they use this kind of with children because it's very small. The catheter is really small, and you can catch urine. You cannot use this on a male, right?
No, I don't.
It's not going to work. It's not going to work. You're going to collect stuff that's in his penis. So you would not use this on a male, but you use it on a female and a child. Okay? Same thing, sterile gloves, betadine, lubricant, sterile technique. All Foley catheters, all catheters are sterile technique. Just saying. Then you have another Foley cath. So you have all kind of cath kits. This is a straight cath kit too. It's red. You let the urine flow in here and you get rid of it. This is just another kit. The Coude kits, catheters I talked about are red like this, but they kind of bent at the top a little bit.
What deciphers them from the other? I mean, just
The
depend on what
Coude
you're.
the Coude, what you mean, the catheter?
Does it just depend on what the facility has?
Just what the facility has, yeah. She just has a whole bunch here, she's showing them. This is a clean catch midstream urine. I think most of the ladies in here have used this. Wipe down one side, wipe down the center, then you urinate a little bit, and then you go in here. Okay, that's a midstream. Then we have urine collection bin. We have our 24-hour urine collection here. I have used up to 2 or 3 of these. These are for people when they have creatinine clearance. We'll talk about it when we go into the kidney, when we talk about kidney disease. The container has to be darkened, has to be placed in ice at all times, and it has to go straight down to the lab immediately after the procedure's done. A lot of other stuff going with it. We'll talk about it in class. This here is also another specimen collection for if you have to have wounds or something specimen. Here are 2 cultures. Yeah, a lot of stuff to do with these cultures. Now, if you're going to have a wound and the doctor says, I want you to get a wound culture, I want you to start an IV, I want you to give them NSF, and I want you to put them on bed rest, which would you do first? Wound. How do you do the wound? Do I just collect all the goober that's on the outside?
No, you clean it first.
And then you just go straight into the wound. You don't get any of the necrosis or any of the other stuff.
Answer to a question. Okay, that's how you do it. You're going to gather the culture first. You're going to irrigate the wounds with saline, not dry it totally, but wipe away the goober stuff. Then you're gonna gently get your cultures. Here is, you have an anaerobic and an aerobic. And this is old, so it's probably already popped. Once you put your, get the culture, put it in here, label it at the bedside. All this stuff I'm doing, you're gonna do it at the bedside, you're gonna label it, and then you're gonna break the little ampule at the bottom.
For those, just really quick, if I can add, if you don't snap on that lid, they pop off. So if you don't hear them snap, they're not closed.
Okay, you have to secure it, you have to make sure it's totally secure. Here is a sputum specimen collection. If you collect sputum, it can't be, it's gonna have to be, it has to be a real goober, early in the morning. And we'll talk about that when we talk about TB. It has to be a good one, because if the saliva, guess what, it comes back at you, and they'll say, go collect another one. But that's one collection. And here's another collection. I like this one better, because then you don't have to really look at it too much. You have to disconnect it and all, but I've had my day of collecting sputum, but the same thing, it has to be good specimen collection. This is the stool collection for opium and parasite. The hats that I showed, you just kind of get the hat with the stool in and kind of scoop it up. It's actually like a little spoon. You kind of scoop it up in there.
How much do you need? Is there a fill line?
It's usually a fill line on here, but I don't see the fill line. But I would put as much as I possibly could in there to satisfy the people because I don't want them coming back again. And last but not least, this other coax. This is hemocoat. This is for stool. Again, stool from the hat. You take the little popsicle stick and you turn it over here. You have an A and a B. You scoop up, put something in A, you turn it over, you scoop up another part, you put it in B, you close it up, you open up the other side, and you put your reaction agent on the side, and it'll turn blue as positive.
She was saying in class that nurses aren't allowed to put that solution on.
Yes, that's what I was gonna say here.
Okay.
We were not allowed to put the solution on because we were not keeping up with the expiration date, and we were not doing the, what they wanna call it, the, skills on it, and they took it away from us.
Is that just in a hospital?
Well, no, some of the other students that were in here that worked in hospital, they said they do them now.
Yeah, because I was gonna say, I've done that in an office just recently,
Yeah.
but I know where to put the drops, but if it was taken away from nurses, but not all healthcare people, that
Well,
makes sense.
so it's not that granular about it, just according to the organization.
Okay.
And like, I worked for the Abrazos, and Abrazos said no. I think, Professor DiMaggio worked for Banner, and Banner said no.
Okay, so just key is looking at that expiration date, making sure it's not expired, and then checking the facility to make sure you're allowed to put the drops on.
If the facility does not want you to do this, you will not have access to it. You won't have access to it. They'll make you put it in one of these things and send it down to that. Now this right here is, for gastroculture. This is for NGs. Now, I still think we do this in ICU, but I'm not for sure, but this is for NG. And all you do is take your syringe, get some solution from your NG, kind of like the hemocoat, and you put the specimen on, but you put it on just this one side. You don't have a back side. You put it on this one side and you check for blood. And if it's positive for blood, it turns blue. And it's not always blue, but you'll soon find it. Okay? Any questions or concerns about what I just showed you as I just ran through that real quick? Because I know you guys want to start doing your Foley, somebody evaluate the patient. You're doing either the bladder scanner or you feel it palpating the bladder. And you're saying, I think it's like step number 2 or 3 or something like that. Okay? Any other questions? Any concerns? Doubts? Worries? Nothing? All
What
right,
do you
go
check?
for it.
What are you checking for when you do the palpations? Like,
You're checking for if the patient complains of discomfort right in the pelvic area where the bladder
like
is.
pressure?
Or if it's boggy or hard.
Okay.
Yeah.